Welcome to all of you in our webinar today, and good morning and good afternoon to some of you based on your time zone. Thank you for your time and interest in our Workers' Comp Workflows and Billing Tool webinar. I am Diya Ranjan, Marketing Manager at Bizmatics and your host for today's webinar. And joining me today in our session is our enthusiastic presenter, Monica Walker. Some of you may have heard her earlier. So let me introduce all of you to Monica. Monica is the Business Development Manager at Bizmatics and has over 20 years of experience in practice management, billing, primary care, pain management, and she is also an occupational medicine expert. So in today's session, Monica will explain the documentation process and the various billing tools that you can utilize for workers' comp process. And after the details that she provides, she would be walking you through a demo of how this process unfolds within PrognoCIS. So let's begin. But before that, a few housekeeping items for all of you. The recording and slides of this webinar will be available to all of you in a follow-up email. And for PrognoCIS customers, you can avail these slides and recording in our resource center at your convenience. We also have a question and answer session at the end of the webinar. So please type in your question in the question box at the right-hand corner and send it over to us. We will answer them in order. And last but not the least, we have a poll right at the beginning. So I would encourage all of you to participate, as your answers would be very helpful for us. So welcome to all of you again, and let's begin. Welcome, Monica, and thank you for your time too for today's webinar. It's over to you now.
All right, thank you, Dia. We are going to be talking about the beginning of our session will be some basics about workers' compensation, maybe review for quite a few of you, and then we will kick into a section of PrognoCIS demonstration to show you the different tools and resources that we have built that are particularly helpful in workers' compensation when it comes to pre-authorizations. So I'll let Dia go ahead and put our poll up there.
Okay, so I have the poll open for some time. I will leave it on for a few more seconds.
This poll will be particularly helpful for us to understand kind of the attendees that we have and what your interest is in this topic, and will help us definitely with coming up with some follow-up topics and things like that for workers' compensation. So if you have anything specific that you'd like to also have us cover, please include those in the question section, and we'll make sure that we take that into account later as well.
Okay, so I did close the poll, Monica, and we do have 92% for yes, who do correctly bill workers' comp, and 8% who said no.
Okay, perfect. All right, well, the beginning section will be review for many of you then, but hopefully there's something in here that is helpful for you. So just to give anyone who's not familiar with workers' compensation an idea, basic overview of what it is. Essentially, it's a specific type of insurance coverage that provides medical and wage benefits to people who are injured or become ill at work. Most states require employers to provide workers' compensation at certain levels of coverage for their employees. Each state has different rules and regulations regarding workers' compensation coverage, and most states have specific rules in terms of the coverage amounts, as well as the specific treatment guidelines that are available for workers who are being covered for an injury or illness. Patients who come to your office that have a workplace injury or illness should have information regarding their workers' compensation coverage. They should have the claim number. They should know who their workers' compensation carrier is. If they don't have that information, you may need to contact their HR department or have the patient contact their HR department and have the HR manager or whoever's handling workers' compensation. And some employers, it's the HR that will handle it. Some employers actually have internal case managers or may have a specific company that would help with workers' compensation. So depending on who that is for that particular patient, they should be able to give you information. Every state, as I mentioned, and I'll continue to mention during this webinar, has different rules, but in most cases, if the patient comes in, you bill their regular health insurance and you utilize anything related to an injury in terms of diagnosis or in your documentation if they should review it. The insurance plan will typically either not pay for that care or send you a questionnaire relating to the patient's injury, or they may also send the patient a questionnaire regarding their injury, or even call them and ask them questions before they'll pay their claim. And in some cases, if they do pay the claim, they may come back and recoup that payment later or subrogate it and try to get that reimbursement back from the workers' compensation. So it may cause issues for you in terms of your cash flow, and in a lot of cases, workers' compensation insurance may pay better than the patient's primary care normal insurance or primary health insurance. So you may want to accept workers' compensation insurance, again, depending on your state, the different fee schedules there, and how that compares to other carriers that you work with. To file for workers' compensation care, you typically need to enroll with the work comp carrier and be listed on their panel. So most of the common work comp carriers have a panel of physicians that are available. Some states, such as the state of Tennessee that I'm in, actually require employers to have a panel of their own, a list of a few providers. I think it's 3, at least that was the rule a few years ago. And so they actually have to provide that list to anyone who's injured on the job. And so you may have an opportunity there to kind of market your services to employers, particularly in states where the employer has to provide information to the patient. Just a little marketing tidbit there. And each state might have specific forms that you need to complete. They may have specific rules regarding pre-authorizations and things like that. So we'll be moving on into kind of some state specific information and places that you can look up that information. One other thing that I like to caution you is make sure that as you're treating workers' compensation patients, that you're careful only to treat and document for the specific body part that has been injured or is related to the illness in that claim that you send information to the work comp carrier. If you include any other kind of treatment that you're doing for the patient in that documentation or in that billing, your entire claim may be rejected. So just make sure that if you need to see the patient for multiple issues, that you have 2 separate encounters, or keep that information completely separate. Moving on to the state-by-state rules, we have a few little tidbits of resources here for you. So the Department of Labor has a nice website that gives you a link to state-by-state rules and regulations regarding workers' compensation. So I'm including this link here, and you can go and read more information about your specific state. And then there is a claims clearinghouse that specializes in workers' compensation called Daisy Bill. We do integrate with that clearinghouse if you do a lot of workers' compensation. It may be very helpful, but they do have some free resources on their website, and I also have a link to this, and it's also state by state. And they also have, in addition to the state website for the information regarding workers' compensation, they also have a lot of other resources such as blog posts and things, different kind of geographic issues. They have webinars of their own that you can access. They also have quick links to fee schedules and things like that. So a really good resource for anybody who is especially getting started or just wants to read some of the additional information. The blog posts kind of give you some really specific things that might help you out or might help you with some of the issues you're having. And I think there's a searchable FAQ in here as well. And I think I have a link to that later in the slideshow that you can access for that as well. So while you are looking at your state-specific information, a few things to look for. So obviously you want to make sure that what you're going to get paid for the services that you're providing will accommodate your expenses. So make sure you check out the fee schedule for your state. Also, make sure you're very familiar with the treatment guidelines and the services that require pre-authorization. We're going to focus a lot on pre-authorization towards the end of the demo and kind of the resources we have in PrognoCIS for that, but make sure you're aware before you perform services if you need to have those services pre-authorized. And the pre-authorization process for workers' comp can be a little different than a regular insurance company. You may actually have to have your provider involved in answering specific questions and doing peer-to-peer reviews and things like that. So workers' comp can be a little bit more of an entailed pre-authorization process, but once you get kind of a few under your belt, you'll understand kind of what they're looking for and be able to send them kind of the information that they're looking for up front. There's also a link right here to a page that will give you an idea of what your state work comp guidelines are in terms of the treatments that require pre-authorization and what sorts of things are treated, what types of things are covered based on the body part. Make sure you're also familiar if there are any specific rules regarding claim submission. There are some states that require you to submit the claims electronically. There are also some things related to electronic requirements where if you submit them electronically, they have an obligation, the insurance company being they, to give you a response within a certain number of days. So if you submit your claims electronically, in most cases, you do get paid a lot faster, and we'll talk a little bit more about that in a minute. Make sure that you have an ability to verify the access for the patients having workers' compensation coverage. That coverage verification may come from the state website. It may also come from the carrier website. So just a couple of different things to make sure that you have access to. You want to make sure that you know that if they told you they hurt their low back, that it is specifically low back, and if they have leg pain, you need to know whether that is related to the low back or whether you're going to have to go after a whole other case there. Also, make sure you just research any other articles like those blog posts on the DAISY website, and you may even want to contact an attorney. Some states have rules and regulations, California being one of those, where you're able to put a lien against the insurance company if they don't pay. There's some ability to go to court over some of those things to make sure you get paid, and some of that, there is a lot of precedent for how that works, and it sounds kind of daunting, but it may not necessarily be as daunting as it sounds. You may want to talk to an attorney who specializes in that sort of thing to get a little bit of advice to see if there's some things that you can do to make your life easier. Moving on, this is just a list of the top 10 workers' compensation coverage companies. So if you're just getting started and kind of looking towards which companies you might want to credential with, this is just a little list of 2019 by the premiums written and their market share over there. So helpful information there. And this again will go out to everybody, so you guys will have these links as well as that list there. Just a couple more resources before we launch into the PrognoCIS piece of things. Just bear in mind that if you're credentialing with the workers' comp carriers, not all the carriers may have an open panel in your area. It's kind of like the commercial carriers. Sometimes they'll tell you they have all of whatever your specialty is that they need at the moment. So that may be something you run into. A lot of times the credentialing process is shorter with workers' compensation carriers. So it may take as little as 30 days, but it could also take, up to 120 or more, just depending on the carrier and if they have any kind of delays related to COVID for paperwork processing, things like that. Again, with submitting your claims, most often they also want the progress note. There may also be some state-specific forms that you need to attach to your claims or send with your claims. So if you're able to submit your claims and those attachments electronically together, it will make sure that that information stays together through the processing of the claim. Instead of having to submit the claim electronically and fax the information later, it generally helps the process be a little quicker. And these are just a link to the different payers that are available electronic through TriZetto as well as Waystar. Those are the two that we probably work with most commonly. And then also Daisy Bill, another little link to the FAQ on their website, which lists a lot of the payers as well as just some other helpful information regarding workers' compensation coverage, kind of how it works. It's really helpful. So everything we've talked to this point has been for non-federal employees, non-federal people who work at companies, private companies, public companies, things like that. The federal employee system has their own workers' compensation program run by the Department of Labor. And so they have kind of their own set of rules. In some cases, they follow some of the state rules. In some cases, they have their own rules which supersede everything. But they do administer 4 programs: the Energy Employees Occupational Illness Program, the regular federal employees compensation program, which is an umbrella of basically everyone else who's not one of these other 3 groups, the Longshoremen and Harbor Workers Compensation Program, and Coal Miners Workers. So they have some really specific things for 3 different programs related to some really occupational hazards and things like that, and then the program for all the other federal employees. So at the top there's just a link to some information there, and then on this page, another process is to get started to provide federal employee work comp treatment. You basically go and complete a form similar to a Medicare form to be enrolled in OWCP. 1168. You can also click this link to go to the portal and register and complete your enrollment online on the web portal. So that may save a little bit of time rather than kind of mailing or faxing that form. You want to make sure and also review their treatment guidelines, same as every other one. They do have kind of some basic information on there regarding kind of level 1, 2, 3, 4 procedures and what requires pre-authorization. So a little more basic information there. And they also have a really good FAQ section on their website as well, which kind of sets the precedent for kind of how things should work and what they expect you to submit and that sort of thing. And then their fee schedule is also published right there. So you can go and look at the fee schedule and see if that's something that you're interested in doing. So from here, we are going to now flip into PrognoCIS and look at some of the tools and resources that we have laid out for the staff and patients who are utilizing PrognoCIS. I'm going to go into my database here. So the first area that is commonly utilized for workers' compensation is the case management system. So prior to setting up your case, and again, with your workers' compensation patients, you're going to have a case number typically, so you can load that information in there. But before you put that information in there, you want to put the employer information. So in your patient register under the contact tab, you'll see the employer details section here. So you want to load the employer in the system. And then next you want to load the workers' compensation insurance plan. Just as a little tip here, if you go into your settings and configuration and go into that employer within the system, you can actually, if you know who the workers' compensation insurance company is for that particular employer, you can go and assign it here in the insurance details section. So you search or add that employer, come in here, add it in the insurance section right here. You can even list the policy number and it'll pull for you automatically. So once you list it here, it's going to automatically pull that into any patients that you put workers' compensation coverage information in with that employer in the system. So it saves a little bit of time if you're seeing multiple patients from a specific company. Also, once you attach that employer to the patient, the employer notes show on the scheduling screen as well as in the patient register. So if you have any specific information that you want to put in there for that employer, you can also include some workers' compensation information there, who to contact, that sort of thing, if there's any need for that. So back in our patient register, we want to, again, have our employer listed in the employer details section. In our insurance umbrella, we want to add our workers' compensation plan. You want to make sure and define it as work comp. And then you want to make sure that the relation is the employer. So that way you have all that information tied together. And from here, this information will pull into your encounters, into your claims, into the other information that you need to pull it to, including your case management. So employer, insurance, and then you want to go in and load your case. So when you come into the case screen, that little briefcase icon, you click this little button to add your new case, and then you just start filling out the information. And each state has some specific things they may want you to include in your claim, such as dates they're unable to work or hospitalization dates, things like that. But what's really important is that you have your case number on there, the date of the injury, and the state of the injury or accident, because that will tell the insurance company what state's rules to apply to the claim that they're processing. So you want to make sure and load that information. You want to put as much information in here as you can, just so it's all located in one place so you don't have to dig for it. So as you have more information about a case, as you see a patient or the case kind of comes to a conclusion, just continue to come in here and load as much information as you can, because you'll be amazed how much you'll refer back to this later. We also have the place to put a description here. You want to make sure and load your body areas. A lot of times once patients are used to seeing you for care, if they have another injury, they may want to come back. So once you have another case, it will list your body part there next to the work comp case number, and that makes it a lot easier to see which one you are pulling into your appointments, which we'll talk about in a minute. So making sure that you put the body areas there makes it a lot easier to attach the right case to your appointments and make sure that you get the right information into your claims. Also on this screen, You have the ability to pull that insurance carrier into the screen here. So it may be a situation where you have a patient that used to work for this employer and now works for this one, and they're different insurances, which is perfectly fine. You just want to make sure and attach the correct one there. Once you do that, if you have any pre-authorizations that have been attached to that insurance, you can also access those here. A lot of times with workers' compensation, they may not necessarily give you a pre-authorization number, but they may require you to pre-authorize, certain types of procedures, or you may have to get a pre-authorization every 5 office visits. If you load those in the pre-authorizations and attach those into your appointments, they'll count down for you and tell you when you have one left to utilize. So it does at least give you that extra level of protection to make sure you have those pre-authorizations and have those attached. So if you don't have a pre-authorization number, you can just kind of make up your own, and that makes it a little easier to be able to track that information. If there are any kind of adjusters, typically with workers' comp, you're not dealing with a lot of attorneys or adjusters. You may have a case manager. That might be a case manager at the employer that you want to load their information. You have your employer that's going to automatically pull there for you. You might want to put some job information in there if there's anything that may help you. There's some California specific things with QME and WCAB here. A place to load whether you have a lien on file, put any kind of notes related to the lien. And again, that may have to do with not getting paid and needing to sue for payment. And then you can also document how many visits are approved. So in some states, there's a certain number of visits that are approved based on body parts. So you can come in here and document that. And that'll also count down for you. So every visit that you attach this case to will count that for you. So you can kind of see that there. Also within this screen, we have user definable fields. So this is just a few that we set up, but those don't necessarily have to be what you utilize. You can kind of create your own. And we have a few different field types here. You can even have a pop-up box with multiple different choices there. So multiple different ways to store information. Again, as much as you can put information here, it will help you later to be able to come back and find it. And then if a case is closed, you can document that it's closed, put the date, and then add notes there as well. So a lot of times if there's a situation where a patient is injured and they end up not being able to go back to work, you may get requests for records years down the road. So documenting this information, keeping it all in there could be really helpful for you later on. A couple other things within this screen, there's a place for statement if there's ever a patient statement sent, a ledger so you can see what charges have been done, have that information in there to pull, history of who created this case and who edited it before. So a lot of information to be able to see within this screen. So again, the 3 things you want to load are your employer, your insurance, and your case management. Once you have your case set up, now you want to make sure and utilize that every time you schedule an appointment for that patient for this particular body part. So as we are scheduling appointments for our patient, you want to double click your appointment slot like you normally would. You want to find your patient that you're treating, put her in the system, and it will actually pull the patient twice if you have multiple cases there. Just kind of makes it a little easier to see if they have multiple, but it's not separate charts, just has the case number on there. And then for that particular appointment, you want to pick the case that you are treating the patient for. If you have a patient that you're treating them for multiple cases, you don't have to have separate charts, but you want to make sure and have separate appointments and separate encounters. That way you get the right information pulled into the right one. And as I mentioned earlier, you want to make sure that you don't have any documentation in that encounter for another body part that you're treating. So having those 2 separate encounters, 2 separate progress notes, everything separate makes it a lot easier. I was a customer before I came to sales here, and we had a patient that we actually were treating for 3 different cases, both ankles, a shoulder, and we did their primary care. So there were days that we had 4 appointments for that patient. And the poor provider had to do a lot of that documentation in 4 separate areas, but we were able to bill all 4 of the carriers and not make the patient come to see us. So it really wasn't more of a hassle for the patient, it was just a hassle for us on the documentation perspective. So once you have that information selected within the system, you can then also create recurring appointments. So if you have for instance, physical therapy or chiropractic that you are treating that patient with, once you create that initial appointment and create your recurrence, that case number will go with those appointments as you schedule the recurrences. So that's a little tidbit there that makes it easier. If you know you're going to be seeing them weekly or quarterly or monthly, you can put that information in there. So that is essentially our case management section. The next thing I wanted to cover is some of the documentation tools that are available. So we have loaded a lot of state-related forms, not necessarily all within this database, but we have a library of doctor forms and letter templates and things that you can utilize. So within the doctor form section, they probably won't be within your database already unless you've specifically asked for them, but a lot of these are available. And if we don't have your state's form available, that's definitely something that we can get loaded for you so that can be filled out. So this is, for instance, the doctor's first report of injury that has to be completed for all work comp cases. A lot of times this needs to get sent with the documentation and the claim. So it pulls some of the information from the patient's chart for you. So instead of the old days of having to complete this on paper and scan it in, you can have this fillable form that fills a lot of this information in for you. You can just fill it out on this section. It can be attached to your claims that way. Another one is the progress report. So this is what they call PR2s in California. So we also have those available. This is an example of a Texas work comp work status report. So multiple different options there for uploading any specific forms that you need, whether those be state specific or they could be carrier specific. So we can definitely recreate those forms for you either in this section. We also have the letters out section that we can create fillable forms there as well. So we have multiple different options here, such as a certificate to return to work, and we have some kind of specific forms that have, let me find it here, some specific language that a carrier or a state may require. We also have return to work forms that have kind of some things checked on them. Some cases you might have EAP involvement with a work comp case, so multiple different options to get those forms and letters loaded for you. And once you have those in here, again, it can pull information from the patient's chart, make it a lot easier for you, give you something to be able to quickly generate and print out for the patient or send. We can even create treatment authorizations and forms to send to a physical therapy company that you're referring patients to. So any of that can be recreated within the system so you're not constantly printing and scanning things and filling them out. So that is a few of our available resources. If you want any of these sort of things, or if you have some forms that you need created, contact support if you're an existing customer, or if you're still in the implementation process, just talk it over with your implementation manager. Again, they can go through the library of the available forms and see if those forms are available, and then see what we need to do to get those loaded if not. So our second to last topic today is pre-authorizations. So as I've mentioned, a lot of services related to workers' compensation need to be pre-authorized. So depending on the process for pre-authorization in your office, as well as kind of your volume for this, we have a couple of different things that will help you. You may want to do one of them, you may want to do both of them, you may want to do a combination of the two. It just kind of depends on what's best for your workflow and what kind of resources you have to dedicate to kind of keeping up with these things. So in my opinion, I love the order sheet because it gives you the ability to have open orders, things like consult orders when I'm in a particular case of when a patient had hospitalization, you want to make sure that you get those hospital records. You can create an order for your consult and then see that that's still open. So a big fan of the order sheet. And so the first section we're going to talk about is the order sheet. So we have some newer features of the order sheet that were added a little while after the order sheet function kind of came about. And I don't know how many clinics are utilizing the checklist tab, but it is definitely super helpful. So if you're not utilizing the order sheet, it may need to be turned on in the property section. So again, if you're a current customer, you can reach out to support and they can, I think those properties may be admin properties, they may need to turn those on for you. So if not, then if you already have it, you may just need to add it to your table of contents. And if you need some help with that, again, you can contact support or your implementation manager if you're still in implementation. So when you go to your order sheet and you order a procedure, if you have mark the procedure appropriately, you will have a new tab. So I've entered a procedure order for an injection here. So when I go into my actual order, this checklist tab may either be blank for you or may not have it at all, just depending on which version you're utilizing. But this tab is really powerful because it's based on the clinic form profile, so it's able to be edited in between appointments. So it's a really good place to document. You can utilize it to document your indications for a specific item or procedure, and you don't have to just use the procedure section for procedures. A lot of clinics use it for DME, for physical therapy, for just ordering something that you need to mark done later. So normally you have your procedure template that comes along with your procedure. And if you're ordering it and you're not doing it today, we're not going to complete that procedure tab, but we can complete the checklist tab today. And we can come back and continue to edit the checklist tab, and we can add additional information to it later when the encounter is closed. So the first thing you have to do is create your template that you want to put in the checklist tab. So on this particular patient, I'm just going to put a few things in here. So we have this information so you can kind of see. So it's pending, and I haven't received any of this information yet. So I'm just going to document that I have created this order and I've completed something on my checklist. Again, it doesn't document that it's done. It doesn't put any CPT codes for my procedure in this date. So it doesn't show, excuse me, that I have completed it right now. So to get this checklist tab in here, we're going to walk through those steps. So the first thing you want to do is go to settings and configuration and create your clinic form. So this is the clinic form section. Right next to your specialty section. Functions essentially the same. So you want to create a template. We also have these templates available that can get imported. So again, if you would like to kind of use this one as your starting one, it's called authorization tracking form. And so you want to either create or have this template uploaded for you so that you have this information. I like to have another system where I document my medical necessity, which then can also be pulled into my progress note for that day. That way, everything related to my procedure is all in one nice tidy bucket. So you can add some additional systems, put the indications information in there, and you can even have a separate one for each type of procedure you're doing. So if there are different indications for DME than there are for injections, you could have a different one with different items within your checklist there for them to document why they're doing it. So you have in here just some basic information. So your person who is completing the pre-authorization can document what the status is, if there's an authorization number, so on and so forth right there. Also, you want to make sure that you mark this clinic form procedure checklist. If you don't mark this box right here, it will not appear for you to be able to add to your procedure. So you want to make sure, create this template and put your checkbox in that check right there. So your next step is to mark your procedure templates procedural. So in your specialty template section, you most likely already have those procedures that you have been documenting on. So if you want those available to be ordered in the order sheet, as well as to have that checklist tab, you need to make sure they're marked procedural right here. So you have your procedure template here, you want your procedural box checked. Once you check this box and save it, it is now available in another place in your settings and configuration under the procedures section right here of workflow. So when you click workflow there, assuming that you have entry, assuming that you have documented that it is a procedure template, it will now be available here in this list for you. So if that procedure box is not checked, it will not appear here. Once you have that checked, this section will be blank. You'll have the injection, which is your default procedure template. There'll be a default order template, and I'll kind of show you what that looks like in a second, but you can have different order templates for different procedures. And then you want to add your procedure checklist. So as long as you've marked that that authorization tracking is a procedure checklist, it will appear in this list. So you come here, attach it, and once you do that, now your third tab within that procedure order is available. So now you will have your checklist tab. So before I did any of that, this checklist tab again would either not be there or be blank. So once I have put my order in here, what this does is in your document list, it puts an actual procedure order. So in some cases, an insurance company may want a physician signed or provider signed order for a specific thing that you are treating the patient for. This gives you that document. So putting that order in and having that information here will have that appear here. If you want to put your indications for that procedure, any kind of clinical documentation to substantiate that procedure, it might make the pre-authorization process easier for you. So you could include that information on this checklist tab and then have it added to your procedure output form here. So you can have it added to this information. So we actually, in my practice, had another little box under here that had the indications listed for that particular procedure, and you can have it pull the ICD code or the CPT code, all of that into the document as well. This one just hasn't been set up that way. So that is creating your order. So obviously, once you have your order created, we now in our procedure order list have an open procedure for our injection here for this patient. And you can see when the procedure has been completed because it shows A until it has been completed. So when this patient comes back, assuming that the information that the pre-authorization was completed, then I'm able to go into my procedure tab and complete my procedure within the patient's record there. So once I complete this tab, it marks it done. And then on my procedure list here under CPOE, I will have R there for my results being done. So it kind of closes out that procedure order. And we have some procedure orders reports that you can run and dump into Excel as well. Help to kind of utilize watching those if you want to actually print out a list. So that's the procedure order section. Also, on one more thing to note, you can pull your pre-authorization numbers directly into this procedure as well, both at the point when you're filling out the checklist and putting in the pre-auth numbers, as well as when you're completing it. So it gives you the ability to pull those right in there so that you don't have to worry about doing that later. So everything is already attached, and now that's going to be in that encounter for me. So just another place to be able to access those pre-authorization numbers. So in addition to this module where you can see your open procedures, we now have a new section under CPOE, which may not be turned on in the properties section. So if you're an existing customer and you want to try this out, you just need to put in a support ticket or talk to your implementer if you're still in implementation about having those properties set. But once that's turned on, you'll have this additional item in your CPOE menu where you will now have this list of pre-authorizations. So in addition to your items going into the procedure column, they'll also go into the pre-authorization tracking. Now, the way that this works, it is based on encounter type. So as long as the encounter that I ordered a procedure in is marked as requires pre-authorization, it will automatically dump anything I order into this list. So to get it to show up in this list of the items that need pre-authorization, in settings and configuration, in your encounter type screen, you want to make sure that if you're utilizing this for work comp, that for your workers' compensation encounter types, that you mark them require pre-authorization right here. So this box is what tells it to put everything that I order in this encounter type into my pre-auth tracking. If this is not checked and I see the patient with an encounter type where it's not checked, it will not show up in that list. So it automatically assumes that because I'm seeing the patient for a work comp case that I should, or work comp encounter type, that I would want to do a pre-authorization for that process. There may be situations in which you have ordered something that day, a drug screen or something like that, that doesn't need pre-authorization, and all you have to do is just come over here and hit remove to remove those items from the list. So you may not necessarily want everything pre-authorized for every work comp encounter, but at this point, what controls it is that encounter type. So once I order something and it appears in my list here of pre-authorization tracking, I'm now able to actually send it right from this screen. So again, depending on the pre-authorization process for your state and the carriers that you're working with, for instance, in California, majority of our customers who utilize this system are in California, so that's why I keep referencing California. But in California, there is a specific form that they utilize for this process. So if this was a California patient, I would come in, mark the test that I would like to have pre-authorized. I mark it as RFA, request for authorization, and we have a form automatically populating for that particular situation. So all I have to do is mark it new request, make sure all the other information that I need to is in here. I can also make this bigger if I want to see it bigger there. Make sure that all the information I have is completed, and I can attach any kind of records that I want to. I can attach my request for the initial documentation of the injury. I can document it. I can add my progress note for that visit. Once I do that, then I'm ready to decide who I'm sending that to. So maybe in some cases the state, maybe in some cases a specific entity that does these pre-authorizations, maybe an insurance, a person at the insurance company, could be a case manager. Just depends on who you're dealing with and how workers' comp works in your state, but you should have that person in the to list as long as they're attached either in the case or as the insurance company. So attaching that information to the patient's case management makes it a lot easier once you have them loaded. So once you decide who you're sending that to, it also gives you the ability to decide how you're sending it. So in my insurance situation here, I can decide if I want to print it, if I want to fax it, or if I want to email it. So when I hit send, it pops up the information that we have in the system, so I can confirm that it is accurate, and I can decide which mode of submission I want to do. So in this situation, I'm just going to mark the print button. So it's going to print. It's going to say that my request for authorization was sent and give me a little reference number there. If I get a phone call or I talk to someone at the insurance company, or I know already that it's denied, I can come in here and manually change the status if I want to. It doesn't automatically mark it denied or anything or approved when you get a response back, but when you do get a response back, you can attach that response to the actual patient's case. So this little box right here lets you know that there's a response. So let me filter these by all of them. So here's one here that I actually have a response from. So this is an ultrasound guided occipital nerve block, and my response, I just attached our PrognoCIS logo. But if I had a letter here, I'd be able to come over here, read the letter, see that it was either approved or denied. And if necessary, I might have to modify it and send more information, lots of different things I can do there. So here, so I can actually change it, or I can mark it approved. I can give specifics here, attach pre-authorization numbers, and then that marks it approved. So if I'm filtering my list here by a specific thing, I can filter out all the open ones, the closed ones, in progress. I cannot filter by approved or denied, but I can see that the ones that I have marked approved or not approved have been closed. So it's kind of an open or closed thing here. So once you have those in here, they go here as well as into the patient's document list. So you have that information kind of self-contained in the patient's chart. Also from this screen, if I need to read my progress notes, they're right here. Take a second to load. I can also see any attachments. I can see procedure documentation. I can also from this screen see the patient details. I can see their insurance information if necessary. I can check eligibility. I can also create a message to send to someone. So if I got my pre-authorization in and I need to let someone know, hey, go ahead and schedule this, I can send it directly from here. And then I can also see the patient's appointment history. So if I want to check and make sure, okay, they've already been scheduled for this, I can come over here and see what they've been scheduled for and not have to notify someone. So they tried to make it so that you can see a lot of different things from this screen. It's a relatively new feature, and it's definitely something that they have as recently as I think last week or the week before updated. So there's definitely going to be some additional things that'll be coming to this section, but I think it's a really promising thing. And you don't necessarily have to use this pre-authorization tracking for work comp. It could also be helpful for other types of pre-authorizations for insurance and that sort of thing. Just remember that it's all based on the encounter type though. So if you don't have that pre-authorization or requires pre-authorization in the encounter type, it's not going to appear in this list. So those are our two ways of helping with pre-authorizations. The last little section I want to talk about is just the claim section for workers' comp. So assuming that you attached your case at the appointment level. So for my patient there, I showed in my schedule screen that I was attaching my case into the appointment. So it's right here. And so once I arrive this patient, it's going to automatically pull into the encounter. If I did not remember to attach it to the appointment and I accidentally arrived the patient before I put that information in, I can still go to the encounter and edit existing screen and attach it here. Or if I attach the wrong case, I can always flip it around. So you want to make sure that before the encounters close, that you get it attached. You can also attach it in the claim, but it's just easier to have it attached before it gets over there. So once I have created my claim and I come into my claim screen here, I can now see my patient's claim right here. When I come into the claim screen, you'll notice that because it's a work comp claim, remember my encounter type, I set it up as work comp, you will have this information here and you will be able to see the injury information. So these are the 4 pieces of information, if you have completed them, that will pull into the claim. Typically, in most places, date of injury and the state of accident are the information they're looking for. They may be looking for additional information and we have the ability to store that. So you have that bit of information there. And then under the I, you also have additional information from the case or the claim. So you can see some other information such as the employer here if you need to. You can see just several other different things pulled from the case management screen, like your initial treatment date and things like that. So if there is other information that needs to be pulled into the claim for your state specific requirements, most likely they're going to be under this I section if they're not in that one little injury section right there. So you want to make sure that that information is all pulled in there for you so that when the claim gets submitted, that it's there. And then the last little section is to attach those documents that I mentioned, being able to submit your codes along with your documentation. You hit this little attach button, pick your documents, and you can decide what information you want to attach to the patient's record. It does give you an attachment type. So if your state has specific like first report of injury reports that you need to attach, you can put that information in there. Other supplemental information, progress notes, chart notes, things like that, you can do that. You can also choose those things to carry forward into future claims, so you can see that. And you can also click zoom and pull up that particular document. So once you have that information attached, then you are ready to send your claim, assuming that you've scrubbed all your other codes and that sort of thing. So that is essentially it. Within the slideshow that we're going to be sending everyone, I just put some sections of notes for kind of each screen. So you'll have kind of some of those reminders and things that I covered verbally within here. You'll also be able to, review the recording later if you want to, but this just kind of contains some of my notes there. So that is essentially it. So thank you everyone for joining us.
And thank you, Monica, for all the information you provided to all our attendees. I hope this information is very helpful for all of you. And as Monica mentioned, you can access all the information through the recordings and slides that we will share with you. Our customers can go to the resource center to access it, and the rest can also have it through the follow-up email that we would be sending shortly. I also wanted to remind all of you that we have a very short survey, actually just 2 questions in the follow-up email. So if you answer these surveys, it helps us to decide the topic or the information that you need over the course of further webinars. So please fill in the questions in the survey. So let's go on to the question and answer sessions. Monica, I do have a few questions. So I'm actually jumping onto it. So the very first question is, do work comp carriers access CAQH like the commercial carriers do for credentialing?
Yes, they typically do. As with commercial carrier, it is dependent on the carrier. So if you have a CAQH profile, they typically will access that. And for those of you who may not necessarily be as familiar with credentialing, CAQH is kind of a central repository of credentialing information that when you start to credential with commercial carriers, you load your your CV into, your NPI number, your tax ID, and a lot of other information And that particular website kind of keeps all of your information up to date, and then you have to attest, I think it's every 90 days, that nothing has changed. It also makes sure you keep your license number updated and things like that. So a lot of the commercial carriers access that information, and the work comp carriers do as well.
Okay. So the next question is actually related to Daisy Bill. Can we sign up to use Daily Bill for our work comp and still use another clearinghouse for commercial and Medicare claims?
Sure, you can. I'm not exactly sure what the pricing is for Daisy Bill, but if you're interested in that, shoot me an email. My email is right down here, and I can get some contact information for you for Daisy Bill. But you can just utilize that piece of it for work comp, and they do really have a lot of great resources for work comp, and some for free, but then once you're an actual customer, there's a web portal that actually has a lot more information in it as well, and they have some great resources for kind of some carrier specific information and tricks and things like that that may be helpful as well, in addition to being able to submit those electronic claims and information.
Okay, moving on to the next question. Do we have access to the property to turn on the RFA tracking?
I think that is an admin property. So if you don't have that item on in your database, you can go to the property section and search for RFA, but I believe it's an admin property and support will have to turn that on for you. So if you don't see RFA in the property section, then I would, put in a support ticket and they can turn that on for you.
Okay. So the next question, what attachments or records need to be sent with workers' comp claims?
It depends again on the carrier and the state. So most of the time they're going to want a report of injury, at least on your first claim. And there'll be usually a specific form for the state. Not all states have specific forms. And if there's not a specific form, we probably have some kind of generic ones in there that you could utilize. And then once you attach that, they usually want the progress note for that visit. And they may also want any kind of orders for kind of future treatment, and basically a summary of how long it's going to take to finalize the care and what other things you think that the patient's going to need to kind of get them back on their feet and get them back to work.
All right. So the next question is on RCM. Will the RCM handle work comp billing for us if we are an RCM customer?
They will. We have quite a few customers that they handle RCM, and actually the Kristen, who's the VP of the Revenue Cycle Management Department, has been very helpful in providing me with information, particularly for California for this webinar. So yes, they have a ton of knowledge for workers' comp billing. They do a lot of it, and they really know what they're doing, and they're also helpful in kind of helping you get started with things as well when it comes to that.
Okay, moving on. The next question is, if you submit a narrative report with workers' comp claims, will you get additional reimbursements?
I don't know the answer to that. It's probably carrier specific. I haven't heard of them reimbursing more. It just may be that it might reimburse faster. Because in my experience, I had carriers who, and when I was billing work comp in my previous practice, we didn't submit the claims, or not claims, but the attachments electronically, which that's kind of a relatively new thing. But we would submit the claim, and then we would submit the narrative separate, and they never seemed to always end up in the same place. They were going to a fax machine somewhere, and so it ended up being a delay in a lot of cases, not getting that. We'd have to call them and send it 3 and 4 times. So it may not necessarily reimburse you more, but it may get you paid faster, particularly if you submit everything electronically. But it could be, there might be some carriers out there. I would kind of dig into that and maybe ask, any contact that you have at any of the carriers and see if that's the case.
All right, moving on. Do we have to credential our group practice with commercial carriers or just the individual providers?
As far as I know, it's just the individual providers, but when you do search for an individual provider, for instance, I have a relatively new customer, and he had been credentialed with work comp carriers under a previous employer. So when I searched for him within one of the panels, I did see him enlisted under that employer. So it definitely takes into account kind of where you are, but I don't believe that it's an actual group contract. It's related to the provider itself. So for the most part, it should be a situation where you're just credentialing your individual providers with that panel. But I could be wrong. There could be some carriers that do some group credentialing, but in my experience, for the most part, it seems to be individual.
Okay. And the next question is again on RCM. Does your RCM offer pre-authorizations? And I think this would be more for the PrognoCIS RCM.
Yes, so they do some pre-authorizations, and you don't necessarily have to be an RCM customer, meaning that we handle your billing outsourced, to have them handle your pre-authorizations. I actually had a customer who was interested in doing their own billing, but outsourcing just the pre-authorizations. And it's a pretty low fee. It's less than $5. I'm not exactly sure how much it is, and it probably depends on the volume per pre-authorization. And there's some packages and things that you can purchase if you have over a certain number of pre-authorizations a month. And then there's also, if you're an RCM customer, they may be able to build it into your collection percentage as well, like increase the collection percentage a little bit to accommodate that. So there's some different options there, and it's definitely nice to outsource those if you have a high volume and you don't have a person in-house who can handle those for you.
Okay, I see a lot of questions. This is the last one on credentialing. It's again kind of prognosis based. Does your credentialing department offer workers' comp credentialing?
They do. They absolutely do. I just actually had a new customer sign up for that recently. So yeah, it actually, from what I understand, is a little bit easier process than as I mentioned, than the commercial credentialing. But yes, they will be happy to help you with that if you're interested. We typically charge either for a bundle of carriers or a certain amount of money per carrier that you're credentialed with, and the more that they credential you with, the less the price is, obviously.
All right. Those are all the questions, Monica, that we have for now. And I also thank you once again to you for all the answers, all the informations and tips that you provided for whether pre-authorization, claim submission. I think when we send the slides, everybody will have information on obtaining, state-specific rules and regulations, where to access them. So I hope the webinar was very useful for everybody. You can access, as I said, in the follow-up email. And if you have anything, typically for current customers, you can reach out to support@bismatics.com, as you see on your screen right now, or also reach out to Monica, her email mwalker@bismaticsinc.com. So thank you to all of you, to all our attendees for taking out the time to be here with us today. Stay safe and stay healthy, and take care. Bye for now from all of us.
Thank you, Dia, and thank you everyone for attending.